The problem facing many in our community. As customary with winter, we've seen spikes in common illnesses like flu, COVID, and RSV. Depending on how sick you or your child is, you might decide it's time to visit the doctor. But that can be a tough decision for many to make, especially for those who don't have insurance. For some, they can't afford it, or their company doesn't offer it, or they're just self-employed.
In the small business sector, one illness, one injury could make or break a small business. It could potentially stagnate your business and have you close your business for an extended amount of time.
Yeah, the number of people without insurance in the U.S. has, though, gotten better over the past decade. That's a bit of good news here. Take a look at this recent survey. This was by the Commonwealth Fund. You see the numbers. It found in 2023 an estimated 26 million Americans lacked health insurance. That's about 8% of the country. That is a big change from before the Affordable Care Act was passed in 2010, when 49 million people, at least 16%, didn't have health insurance. That legislation cut those numbers in half. Even still, 57% of those underinsured avoid going to the doctor, and 52% skipped a recommended test, treatment, or follow-up procedure because of the cost. Thankfully, there is a free option for some in our community. It is called the Matthews Free Medical Clinic. It provides quality health care to low-income and uninsured people in Mecklenburg and Union counties. It's important to note here, it's not a walk-in clinic. Patients do have to go through a screening process to verify income, residency, and insurance status. We recently talked to Keisha Murphy. She's a small business owner and a single mother. And she was just one sickness away from stacked medical bills that could lead her to lose everything. That was until she found the Matthews Free Medical Clinic.
Like many Charlotteans, residents of Mecklenburg County, we all have come across a time in our lives where we have hit adversity or we have needed just a little bit of help.
So just a lack of insurance, right, at some point in your life?
Absolutely.
And to have something like this available, how big of a game changer is that?
It is truly a game changer because also being a single parent, you face other challenges, struggles, and choices that you have to make on a day-to-day basis, whether it's paying bills or purchasing groceries or putting gas in the car to take your children from point A to point B.
Even when you're checking out and you're like, there's no bill, there's nothing?
Sometimes it is a little bit of a conundrum because it is hard to associate free with medical services. Sometimes, and even, when you go home, you're looking in the mail sometimes and you're wondering, is the bill going to come at a later date? But the bill never comes. They are truly what they say they are.
Yeah, you can see the impact this kind of service can have, but you may be asking yourself, well, how is this even possible? Especially considering the clinic gets no federal funding. This year, they're celebrating 20 years of being in business, and they're hoping to remain operational for many years to come. That's where you might come in. The clinic is funded by donations, grants, and community partnerships. We went down to learn more about how they're doing good with Share Charlotte. Tell me about the impact you've made in 20 years of helping this community.
Wow. I can talk about what we've experienced, but I don't think anyone could truly understand the impact of somebody that doesn't have health care receiving health care and what it means for their families, their friends. It means getting to go to work. It means providing basic necessities for your family.
If not for this clinic, a lot of people would just simply go without.
They would go without, or they would utilize the emergency department for primary care, which becomes obviously very expensive.
That's the thing, right? They don't get a bill walking out of here, do they?
No, absolutely. Everything is free. All of our primary care, educational, pharmacy, labs, every single service is free.
Okay, how do you pull that off?
Well, we have a very generous community. We have a great staff, but it's our volunteers and our partnerships in the community that really allow us to do what we do.
When's the first time you heard about this clinic?
Probably 15 years ago in the Matthews community. It's been well received for many, many years, and I've had an opportunity to work with some other organizations, and I got pulled in to the clinic, sat on their board for a number of years. It's been a while.
You said
it's been a while.
You said you were pulled in. I'm guessing you're glad you were.
Absolutely, absolutely. When you look at the board and the volunteers and the staff with the clinic, it's phenomenal.
As you point out, you're not a doctor, you're not a nurse, but you fill a critical role here by volunteering, right? By helping raise money, raise awareness, be out in the community. Describe a little bit about what you're doing and why it's really kind of important.
Yes, you have a medical need for here, but it's also great to have legal expertise, financial expertise, background from the small and large business communities, others in the community. So if you look at the board makeup that we've had for a number of years, we have a sprinkling of all that.
Where does the providers come from? Are they volunteering from other practices and hospitals?
We have one staff provider that is paid. The rest of the volunteers that come on site are all volunteers. So we have a volunteer cardiologist, gynecologist, physical therapist, gastroenterologist, the list goes on. And so whatever they do in their everyday life is what they bring to our patients.
So they're off doing their normal practice,
They
they're
are.
working at the hospital, their own office, and then
Yeah.
giving up their time and coming
They
in
are.
here on other hours.
Right.
How amazing is that?
It's phenomenal. And they've been coming not just a month here or there, they have been coming for years.
What have you sort of learned about the need and how this can fill the gaps that we see in our community?
There's a big misconception that there's plenty of healthcare facilities available for everyone. And sometimes that's true if you're insured, if you're employed and you have that insurance coverage, but not everybody has it. And they're employed. So even if you're employed, you might not have that coverage. And so that's where a clinic like this, Matthews Free Medical Clinic, really builds that gap.
We really feel that healthcare is a basic necessity for people. We want to be a part of that and partner with people. We want them to have a healthy life. We want them to feel better so they can go to their kids' games, so that they can go to work and not miss, so that they can feel more like themselves. But a lot of times what happens is people can be reluctant. It is hard to ask for help. And so what we like to do is to make sure they understand that this could be anybody that needs our services. And it could be anyone, your neighbor, your friend, and we're here to help.
Incredible work they're doing. Like we said before, there are qualifications like living below the poverty line, not having Medicaid. We'll put a link on our website for more details. And if you'd like to volunteer or donate to this incredible cause, just scan the QR code on your screen to get to Share Charlotte's website. And once you're there, search for the Matthews Free Medical Clinic. Coming up next.